Hello everyone. In this video we'll learn about ego defense mechanism. This is Rima Stanley, lecturer at M College of Nursing. Objectives of this video: to understand what is ego defense mechanism, purpose of defense mechanism, classification and its clinical importance. Now let us see what is ego defense mechanism. So human beings constantly experience anxiety, conflict, stress and unacceptable thoughts or impulses. So they use this in order to protect the individual from psychological distress, and the ego unconsciously uses certain strategies. So these strategies are called as ego defense mechanism. They help maintain emotional balance and protect from self-esteem, but excessive use may lead to maladaptive behavior. So by definition, if you see, it is ego defense mechanism are unconscious psychological strategies which is used by the ego to reduce anxiety which arises from unacceptable thoughts, feelings, impulses or conflicts. So the concept originally was proposed by Sigmund Freud and later elaborated by Anna Freud. Now let us see the purposes of defense mechanism. So they helped basically to reduce anxiety and emotional pain. They help to protect self-esteem, help individuals cope with stress. They help in maintaining psychological equilibrium and prevent awareness of unacceptable impulses. Now, ego defense mechanisms are broadly classified into immature defense mechanism, neurotic defense mechanism, and mature defense mechanism. Immature defense mechanism are primitive, less effective, unconscious way of coping strategies that distort reality and are commonly seen in children, adolescents, or individuals under severe stress. So the key features of this type is that they are poor adaptation to reality, they reduce anxiety temporarily, and often create problems in relationships. So common in personality disorders. So some of the examples of immature defense mechanisms are denial, projection, regression, acting out, etc. Coming to neurotic defense mechanism, these are intermediate level unconscious strategies that help individual cope with anxiety while partially distorting reality. So the key features is that it's common in normal adults. It's a moderate level of anxiety reduction. Some awareness of feeling may be present and can become maladaptive if overused. So examples are repression, suppression, displacement, reaction formation, rationalization. While the mature defense mechanisms are healthy, adaptive coping strategies that helps individuals manage stress without distorting reality. So if you look at the features, they help to promote emotional growth, they improve social functioning and associated with good mental health, and they are conscious or near conscious use. So examples are such as like sublimation, compensation, humor, altruism, etc. So the differences at a glance, if you see, the immature defense mechanism has poor level of coping or adaptation with high reality distortion, and mental health, if you see, it is maladaptive. While neurotic, it's a moderate level of adaptation with partial reality distortion, and it's quite common. While mature defense mechanism, they have high level of adaptation with minimal reality distortion, and it is healthy to use. Now let's look into the immature defense mechanism. So the first one is denial. Denial is nothing but refusal to accept reality or facts, and commonly seen in early stages of illness or loss. Often this is the first stage of grief as mentioned by Kubler-Ross. For example, a patient diagnosed with cancer says, "The reports must be wrong. I feel perfectly fine." Now, coming to projection, so this is attributing to one's own unacceptable thoughts or feelings to others. For example, a student who dislikes a teacher says, "The teacher hates me." Other examples include such as infidelity. An unfaithful person might accuse their partner of cheating. Coming to regression. So, this is reverting to behavior of an earlier developmental stage. For example, a hospitalized adult patient starts crying and demanding attention like a child, or excessive dependence, childish anger, talking like a young child, or avoiding conflicts by becoming passive, etc., is an example of regression. Then is acting out. This is nothing but expressing unconscious feelings through actions rather than words. For example, an angry adolescent breaks objects instead of expressing anger verbally. Next is neurotic defense mechanism. So the first one is repression. These are unconsciously blocking painful or unacceptable thoughts from awareness. For example, a person who experienced childhood abuse has no memory of the event. Next is suppression. This is unconsciously pushing distressing thoughts out of awareness. For example, a student postpones thinking about exam results to focus on a family function. So, here the person consciously tries to forget painful events. Next is displacement. This is redirecting emotions from a threatening object to a safer one. For example, a nurse scolded by a doctor vents out anger on a family member at home. Next is reaction formation. This is behaving in a way opposite to one's own true feelings. For example, a person who feels hostility towards a colleague behaves overly friendly. Next is rationalization. This is nothing but giving socially unacceptable reason. Sorry, giving socially acceptable reasons to justify unacceptable behavior. For example, a student who fails an exam says the paper was unfair anyways. Now, coming to the mature defense mechanism, first one is sublimation. This is channeling unacceptable impulses into socially acceptable activities. For example, an aggressive person becomes a, a professional athlete. Next is compensation. This is covering up one's weakness by emphasizing on other strengths. For example, a person who is weak in academic excels in sports to gain recognition. Next is humor, that is using humor to deal with stress or painful situation. For example, a patient jokes about his hair loss during chemotherapy. And last one is altruism. This is dealing with stress by helping others. For example, a grieving person volunteers at a charity organization, etc. Now, all these defense mechanisms that we have learned could become adaptive or maladaptive. When it is occasionally used, it is normal and healthy. However, excessive or rigid use may lead to poor coping, distorted reality, and psychological disorders. Therefore, mature defenses are associated with more better mental health. Now, let us see the clinical importance. So, clinically, it helps nurses and mental health professionals to understand patient behavior. It helps in identifying coping pattern, helps in planning appropriate intervention. Also, it is important in psychiatry, counseling, stress management, psychotherapy, etc. Keynotes. So, ego defense mechanisms are natural and unconscious coping strategies. They protect individual from anxiety and emotional conflicts and help in understanding this mechanism improves self awareness, empathy, and clinical care. So, healthy function depends on the balanced use of mature defense mechanisms. Reference. Thank you for watching this video.